Good morning. My name is Ann Maitland. I'm actually an allergy immunology specialist, and I had the pleasure of working with Dr. Ruhoy at Mount Sinai, where we're trying to build a Chiari EDS center. It's a tour de force, and we have some really special talents trying to do so. I wanted to share how I fell, as an allergy immunology specialist, fell into the world of neurology and neurosurgery. I started seeing patients, I would say, dating back to 2005, who are having hypersensitivity reactions, and classic allergy testing wasn't explaining it. So rather than say to the patient, you're crazy, which a lot of patients end up hearing, or I just listened to their stories and said, I don't know what's going on, but I believe you, which is important to do validation of somebody's symptoms, because I believe most people don't really want to spend time in the doctor's office. They rather enjoy their lives. And so I would say in 2012, I met a little boy, and I was the 11th allergy immunology specialist that he had met. He was suffering with anaphylaxis, gastrointestinal distress, joint pain, neurocognitive impairment. And I was the 11th allergist, but I was the 27th practitioner that evaluated this boy up and down the Eastern Seaboard. And instead of just repeating the same tests that the other 10 had done, I am from the Bronx and I'm a little bit competitive, so I decided I wanted to think about it a little bit more. And I just listened to the mom's story. And it just dawned on me that I only know 2 cells in the body that can cause somebody to be well and not well that quickly, and that's the nerves and the mast cells. So I would have to say that mast cells were originally the first immune cells described back in the 1800s. And they were essentially forgotten because they don't circulate. They sit inside the tissue. Matter of fact, they sit right next to mast cells and blood vessels. Their job is to be like first responders to every part of the body that's exposed to the environment. So the average adult has 75 square feet of territory that's exposed, whether you're eating, drinking, your skin, your respiratory tract. And you have to vet 10 times the amount of items within a centimeter of all of your border linings that you have cells in your body. And it's kind of like having your skin and your gastrointestinal lining is like a thin chain link fence that helps keep out, anybody who's just trying to be an opportunistic organism. But anybody who is, anything that's really pathogenic, or you have any type of a physical trauma, you have to have backup. And, I grew up in the Bronx, which I shared with several people yesterday. And in the 1970s, that was a little bit challenging. New York was facing some challenging times. And we had a house with a little fence, which would keep out most people, but we also had a German Shepherd, and nothing happened to us. So think about mast cells as that German Shepherd. They know how to recognize what's good for you, and they hopefully know how to recognize what's dangerous for you. And that's what mast cells are. They're your first responders. They have a bunch of receptors to try to figure out what kind of danger is coming in and disturbing the peace. So this is what was seen by a scientist in the 1860s. And actually, this was inside frogs. And then Paul Ehrlich, who went on to win the Nobel Prize, which I think I depict, won the Nobel Prize not only for his discovery of the immune system, but also translational medicine. So if you want to talk about personalized medicine, this is the gentleman who started that in the first place. And what was interesting is, although these cells were identified in the 1800s, we didn't really have a job for them. So I want to share a little joke that was by Ed Young, who's talking about COVID and mast cells in the immune system. And he put up this joke out there. It's funny. An immunologist and a cardiologist are kidnapped. The kidnappers threaten to shoot one of them, but promises to spare whoever has made a bit greater contribution to humanity. The cardiologist says, well, I've identified drugs that have saved the millions of lives of people. Impressed, the kidnappers turn to the immunologist. What have you done? They ask. The immunologist says, the thing is, the immune system is very complicated. And the cardiologist says, just shoot me now. So in many ways, the immune system, and he went on to say that the immune system, and this is why I think it's very important to understand the relationship between mast cells and nerves. the immune system is as complicated as the nervous system, and they talk to each other all the time. They have to, because you face challenges every time you breathe, every time you touch something, every time you swallow something, and you have to figure out whether or not that's something helpful to you or not. So let's do a Reader's Digest version of inflammation. Basically, you can think about any layer that's exposed to the environment. I already told you that the skin, the gastrointestinal tract, the respiratory tract, and the urogenital tract has to deal with a lot of foreign substances. Some of it's friendly, some of it's not, and you got plenty of squatters as well. So the question is, if something's coming in, inflammation helps, keep things in check. And also sometimes, you have tissue that breaks down. So basically you have all these cells that's like a coordinated orchestra in order to make sure that your body stays at a healthy homeostatic state. But as you can see, the mast cell got very little attention. And actually, the mast cells really didn't start getting more attention until the past decade, I would say. And I'm a T-cell biologist by training, so I actually had to kind of get re-educated on what mast cells do. So mast cells started getting more attention because I would say in the late 1980s, 1990s, and I'm going to date myself a little bit. Growing up in the Bronx, basically peanut butter and jelly on Wonder Bread and milk was everywhere. No one had asthma. If you had a rash, it's because you literally had chicken pox or something like that. And within less than 20 years, you have kids that have to have EpiPens. We have food allergies listed at every restaurant that you go into. So literally, is that our genes or is that the environment? And I would have to say it is our genes in a changing environment that was very disturbing to cells that you had inherited from generations after generations after generations. And so what we started seeing is first the people who were most affected by these hypersensitivity disorders were children, but then it started catching up. And now I'm starting to see seniors who are having hypersensitivity disorders, and allergy testing is not explaining it. And I just want to give you an idea. Dr. Ruhoy had mentioned, get rid of that. Sorry. Coach is not available. Okay. The mast cells have the ability to secrete chemicals that can detoxify snake venom. They have the ability to send out chemicals to call in help from the adaptive immune system and other components of the innate immune system, neutrophils, eosinophils, T cells, B cells. The first substance that was identified in mast cells wasn't histamine, it was heparin. And I actually had one patient who had a terrible hypersensitivity event that he started to bleed and clot at the same time. So mast cells have the ability to control blood flow, and they have the ability to tell the tissue how to remodel, kind of like wall off some type of an insult. So a lot of potent chemicals. And as Dr. Ruhoy had mentioned, that mast cells are strategically located right below the surface area of whatever you're encountering, the linings that are exposed to the environment, the fact that they sit right next to the nerve, so it's kind of like SEAL Team 6, that they're able to communicate very quickly in order to respond to any challenges, and they sit right next to blood vessels, so if they need to call in help. So really it's this triad, I would say, of the epithelium or the connective tissue, the nerves, and also the immune system, with mast cells being at the top of it, not the T cells and the B cells. And this is just saying that they have the ability to recognize lots of different challenges, whether it's a physical challenge, an infectious challenge, or a toxic challenge. And toxins can be manufactured, like Febreze for some people, or perfumes, or naturally occurring, like snake venom or mosquitoes. And actually, you can identify people that have connective tissue issues because they typically will have large local reactions to mosquito bites. So this is just to give you an idea of all the different things that mast cells can do. They have lots of different types of receptors to recognize different dangers. And I think what's important in this community is they actually have receptors that can recognize opioids. So for some people, they will not have really good pain relief just because that receptor is interfering with the effectiveness of the pain management. They also have they have estrogen receptors and progesterone receptors. So it's not unusual for women going in or out of their menstrual cycle. And what we really find is for young girls, if they have a connective tissue issue, the manifestations of the disorders that travel with the connective tissue issue typically happen with the onset of their menses. And so it's important to understand that the mast cells have the ability to respond to not only external challenges, but also chemicals that are released by the body. And then depending on what the mast cells see with these various receptors, they have lots of different chemicals that they can release. So what we've been seeing over the past 20 years really is a lot of modern miracles regarding the reduction of major infectious agents. As you can see by this article from New England Journal of Medicine from early 2000s, I believe. But at the same time, when we're starting to see hepatitis come under control and polio and measles, mumps, and rubella, we started seeing a huge surge in not only immediate hypersensitivity disorders such as asthma, but also delayed hypersensitivity disorders. We diagnosed a 1-year-old with Crohn's disease, rheumatoid arthritis, Sjogren's, autoimmune neuropathies. We're basically seeing the immune system turn itself onto the body instead of spending more time going after dangerous entities. And you can see this is an article by a colleague of mine, Dr. Theorides, who basically showed that dysregulated mast cell activation can contribute to pain syndromes, can contribute to irritable bowel syndrome, cancer, increased susceptibility to cancer. So we have lots of different things that we need to start thinking about, because if we think about mast cells, you might come up with different therapies, not only preventative, but also to get certain conditions under control. So as Dr. Orr mentioned yesterday, what we eat, breathe in, wear, apply to our skin has dramatically changed. So why are we seeing this? And I'm doing it from an allergy immunology perspective, but you have to really think about the fact that we spend 95% of our time inside of something, and you have to hope that the ventilation system is fine, the carpeting is fine. The food that we have no control over that as well. That's been completely changed within 30 years. Access to processed food is much more easy, so we have a lot of food deserts where people don't have access to affordable, nutritious foods. And then even the materials that we wear. I find, maybe some of you might notice that you do better wearing more natural fibers, such as cotton, as opposed to processed polyester type clothing. And so all of that is challenging our borders, and that by those challenges, the immune system is being recruited in. So within the past, I would say 20 years, again, you're having a lot of acute inflammation that's now being converted over to chronic inflammation, such as the diseases that are listed all the way to the right. That's covered by that. See, I'm going to do something. Come back here. And then not only are we seeing a rise in these delayed hypersensitivity disorders, including immune-mediated neuropathies, we're also seeing a huge number of immediate hypersensitivity disorders. I had talked with someone last night who ended up having a meal that she didn't know had tree nuts in it, and she had gastrointestinal distress, and actually that is a form of anaphylaxis as well. So nearly 10 years ago, I had to rethink what mast cells are besides outside of allergies. And a lot of it points to the different receptors that are on the mast cell, including the ones that recognize antibiotics, such as levaquin. So it's not unusual that a lot of patients that have a connective tissue issue don't tolerate fluoroquinolones. They might not tolerate certain types of pain medications. They might not tolerate certain types of anesthetics. And a lot of times that's found out once you're on the table, as opposed to knowing about it ahead of time. So instead of calling it allergies, we renamed it mast cell activation syndrome. And essentially, instead of trying to figure out what the triggers are, let's just try to figure out whether or not the mast cells are actually contributing to your symptoms. And it's a very simple formula. Are you having recurrent symptoms? Pain, gastrointestinal distress, fatigue? Are we able to detect a change in the mast cell activity? Typically, we're looking at surrogate markers that are either in the blood or the urine, but you have to remember that this is a tissue-based cell. So if you really want to figure out what's going on, for instance, if any of you have had an endoscopy or colonoscopy, you need to tell the gastroenterologist you're having issues. You have to use certain stains to identify the mast cells or you won't see them. And then, do you get better with medications that target the mast cells? Benadryl, Pepcid. Those are antihistamines. So you'd be surprised. So the formal definition is, do you have signs or symptoms affecting at least 2 organ systems or not? So I use a questionnaire that literally asks you, do you have headache disorders? Do you get irritable? Do you have gastrointestinal distress? Do you find that you're urinating at night? Do you have respiratory symptoms? And I want to emphasize the respiratory symptoms. You know, asthma affects 10% of the population, but internists, pediatricians, family medicines do not screen for this disorder. And so a lot of people are walking around, especially if you're fatigued. I would strongly recommend that you get a breathing test to make sure that you don't have involvement of your lower airways. Otherwise, you won't find out until you have a fulminant attack. Do you get better with medications that target the mast cells? And I already mentioned histamine blockers, which are over the counter. And then once you get a good story, do I have some testing that can point to the mast cells being part of the culprit? So these are two different studies that show what happens if your mast cells are broken within. Very rare for the most part. Mastocytosis affects maybe 35,000 in this country. There's another condition that's been recently identified, which I'll get into a little bit further, but it's called hereditary alpha-tryptophanemia, or HAT. It's believed that 7 to 8% of the Caucasian population has this mutation, a gain of function. So basically, your mast cells go from a Saturday night special to a Colt 45. And it's important to understand that once the mast cells are triggered, depending on how many chemicals they release, this is how symptomatic you'll be. And what I also want to point out is whether you have broken mast cells or your mast cells are just following bad orders, like you made an antibody to peanuts, or you have a neuropathy, or you have, you're in an environment where you're just exposed to a lot of chemicals that are revving up both the nerves, the epithelium, and the mast cells. It's important to understand that the major presentations of these patients are skin issues, gastrointestinal issues, but the third most common is neuropsychiatric, mood disorders, pain, headache disorders, exertional fatigue. And so it's important to screen for mast cell disorders. And all of you have had or are caring for someone who's had a chronic disorder, but the likelihood that you've been evaluated by an immunology specialist is very unlikely. And so I'm hoping that these, the next items that I'm going to share with you will be a set of tools that you can take back to your practitioner to say, this is very simple. It's a questionnaire, just asking what your symptoms are, medications that you've tried in the past, and then ordering some blood tests and urine tests. This is the questionnaire. It's going to be part of the talk, but very simple. You just check it. And if you check 2 of the organ systems, you need to think about mast cell activation disease. And then, do you get better with medications such as histamine blockade, Singulair is a leukotriene antagonist, or Montelukast. Nasal Chrome is over the counter. It's been over the counter for 40 years for people that have congestion issues. The more bigger guns is a biologic called omalizumab, which is now indicated for 6 and up for asthma and 12 and up for chronic hives. So if you have chronic itch or hives, you have a medication that has the ability to really quiet the mast cells down in many fashions. And then you have a medication that's over the counter as an eye drop here in the US, but it's readily available as a pill in Canada as well as Europe, called Connective. And then these are some of the markers, again, that we look for to see whether or not your mast cells are contributing to your symptomatology. So I wanted to say why you should think about mast cell activation disease. Understand that mast cells play a role in defense. They play a role in blood flow, like to your head. So think about migraine headaches or cluster headaches, where if you take medications that change the blood flow, the mast cells will be able to stand down. They have the ability to help modify tissue and reproduction. And what I really appreciated what Dr. Das's talk yesterday was talking about how important it is to recognize ahead of time. Prevention goes a lot further than me trying to put that fire out after it happens. And so what we see in individuals that have mast activation disease, they have wound healing issues. They have increased susceptibility to infections. They have adverse reactions to medications, especially around the surgical procedures. They have bleeding issues. They will have risk of aberrant tissue formation, such as fistula formation that I was hearing in the lectures yesterday, talking about some of the complications that are associated with Chiari and Syringomyelia surgeries. And then you also see who's at risk, particularly females, right? Here's the estrogen receptor, progesterone story that is also on mast cells as well. So I always like to have a little brief intermission, and this is a joke that I used to have when I was a kid. So what's white and gets dirty? So zebras is actually the moniker for individuals that have EDS, and these are just lots of zebras that are rolling around in the dirt, having lots of fun. But unfortunately, zebras in this country actually have a lot of pain. And I'm hoping that if you just think about the fact that you need an immune workup if you have a chronic issue, this might offer you some relief and possibly change the course of what you're dealing with. So again, here's symptoms. Do you get better with medications? And here's some laboratories suggesting that you have mast cells that are misbehaving. You need to figure out why your mast cells are misbehaving. You just don't want to control the mast cells. If you have an infection, your mast cells are jumping into the fray, they're trying to help. You don't want to just restrain them if they're trying to fight off an infection. So I'm going to briefly go through what we see with connective tissue issues. So you see this young lady here who definitely fits the criteria for hypermobility. She came in over a decade ago, and you can see allergy testing. She's lighting up, but her elbows are bent. Her ears, and actually the test that I did for my patients, I'm not hypermobile, so I have them pull on my ear, and they're like, your ear doesn't move. I'm like, yeah, that's why my grandmother was able to, school me when I misbehaved, because it hurt. But if your ear is pliable, that suggests that you have some element of connective tissue laxity. And then, as we know, or as Dr. Ruhe had mentioned, most EDS patients don't have a clinical diagnosis or genetic marker that shows that. But there's some interesting information coming out now that there are abnormalities in the immune compartment that may be contributing to a diffuse connective tissue disorder. I already told you about hereditary alpha-tryptosemia. Interestingly enough, periodontal EDS is not a mutation in the collagen machinery, that's a mutation in the complement system. So again, the immune system has the ability to globally act on the connective tissue. So the connective tissue talks to the immune system and the mast cells talk right back. So the person that kind of opened my eyes, again, was that little boy that I told you before. This is Sean, and his mother was kind enough to provide pictures when he was first born, and you can see this is when I met him at 4 years of age. And again, he was having lots of different issues with his respiratory tract, his central nervous system, his gastrointestinal tract, his skin. So does he have mast cell activation disease? Just a quick set of hands. Does anybody here think he has mast cell activation disease or syndrome? So he had the symptoms. He actually responded very well to medications that targeted the mast cell compartment, but his testing was not helpful at all. And that's because we just didn't have the tools, and we still are needing the tools that help. So I usually treat people as MCAS or MCAD-ish. Most of the medications that we use are well tolerated. We are able to follow that benefit-risk ratio. And I think it's worthwhile doing a trial at least I do a trial of about 4 weeks with medications that target the mast cell compartment while I'm trying to figure out why they're misbehaving. And again, the markers were kind of lacking in identifying mast cell activation disease. The best way to identify whether or not mast cells are misbehaving is you got to go into the tissue, especially if you had endoscopy or colonoscopy. And what has been shown of late, and this I just wanted to show that here's all the different things that can cause mast cells to misbehave. So I have cold-induced urticaria. So I have to get some tea in a little bit before I start hiving up. But people have vibration, solar, lots of different ways that mast cells and the epithelium will cause a chronic inflammatory disorder to happen. Screening for Ehlers-Danlos syndrome, everybody's heard about the Beighton score. I actually prefer the French criteria. And they live in a lot of these patients because on average it takes anywhere from 1 to 2 decades to get a diagnosis of Ehlers-Danlos syndrome. It really is, again, going back and getting a very good history. And they have identified in over 10,000 patients, if you have at least 5 of these syndromes, you are 99%, over 95% have a specificity and sensitivity of having a form of Ehlers-Danlos syndrome. So do you have joint pain? Do you have fatigue? Do you have what's called the door sign, like you find yourself bumping into chairs or tables? Do you have problems with wound healing or easy bruising? Have you ever been treated for reflux? And do you have sound sensitivity? I apologize if this is a little bit too much. But here's an easy way to identify whether or not you should go ahead and get evaluated and I would err on the side of a geneticist that's savvy in this space. For the most part, most rheumatologists have not been trained on this, so they'll just say you have mixed connective tissue disease. because or non-serologic arthritis. And that's just saying they can't find antibodies. And then this is a review that I had done. It's a retrospective study that I had done, nearly 1,000 patients that came through our practice saying that they had mast cell disease. And what was really interesting is 19% had mast cell activation syndrome, EDS, and immunodeficiency. So a lot of people can walk around not having enough components in their immune system, making them susceptible not only to recurrent or severe infections, but also autoimmune diseases as well. This is the story about hereditary alpha-tryptophanemia. This is a woman who had been suffering with, quote unquote, 3 mysterious debilitating diseases, EDS, mast cell activation syndrome, and POTS. And the gene was identified in 2016. So she finally had a genetic answer to what was causing her to have all these issues. So this is what she was dealing with. And as I said before, they've identified at least 7%, meaning if you have a tryptase of 8 or higher, you should be screened for this genetic disorder. And then I just wanted to highlight, if you don't ask the pathologist to stain for mast cells, you won't see them. But interestingly enough, it's a subtle difference. But people who have mast cell activation syndrome from hereditary alpha-tryptophanemia, their mast cells start to cluster. It's kind of like if you've ever seen a bank that got robbed, all the police gather. That's what mast cells do. And then since that bank was hit, they're going to stay there. So that's what mast cells do as well. So when it comes to treatment, again, it's important to figure out whether or not your mast cells are misbehaving because they have something broken in them, or there's something that's driving the mast cells to release those chemicals. Again, good soldiers following bad orders. And I often use the analogy of laws on the books. For instance, some states, Catholics couldn't marry Protestants. So I think it's important to understand that if your body is in an environment it doesn't like, the mast cells are going to act up. I wanted, and again, this is something that you can keep. These are medications that are better tolerated if you have mast cell dysfunction, and these are medications that you should avoid if you have mast cell dysfunction. So the ones on the right, the blue, these are medications that are better tolerated. And then the ones on the left, these are the ones, the red, avoid. Okay, vancomycin, fluoroquinolones, problematic. Muscle relaxants, very important for those that are undergoing surgery. Pain medications. Generally speaking, I find fentanyl to be better tolerated. Dilaudid, a little more so. You might need more active pre-medication to help with that. And then vaccines, very controversial right now, especially with the coronavirus vaccines. I have to tell you, I've been vaccinating my patients, and a lot of them have the trifecta of EDS, mast cell disease, and autonomic dysfunction. Only 2 people have had adverse reactions with pre-medication protocol that I gave them. And here's the thing, I'm not aggressive about it. I'll break up the vaccine. I'll give you a half dose after I do the pre-medication and hydration, and then I'll give you another half dose a week later. There's no rush, right? But I think people should be given the information on how they can protect themselves, even against the possibility of having an adverse reaction to a vaccine. Everybody gets an action plan from me, written, that they can take to the other practitioners. This is readily available on tmsforacure.org. And then they also have an action plan, just in case you're found down. I have to tell you, I've used my EpiPen on attendees at conferences at least twice a year before the pandemic. So people don't know that they have a problem, and sometimes they just need to be educated on how to use their rescue medication if they do run into a problem. Just to give you an idea of the different medications that are available, again, we start off with medications that have a long track record of safety, even in pregnancy and in children. The ones that, individuals that have the rare form of mast cell disease, they have a broken mast cell. There are some more medications that are coming out. It's very exciting. This is an exciting time to be in immunology and mast cell dysregulation. This is, again, pointing out it's important to figure out why your mast cells are misbehaving. And so these are various the various reasons why mast cells will misbehave, whether or not you have allergy-like mast cell disease, or you have an undiagnosed chronic infection, or undiagnosed immunodeficiency, or an undiagnosed or not well-controlled autoimmune disorder. I also am a big fan of exercise, but it should be tailored, especially if you have any type of central nervous system involvement. Yesterday it was mentioned important to have core treatment, and I also say the same thing for diet. You know, there are a lot of diets that were mentioned yesterday. They're all over the place. I think it's important that you work with somebody who's going to have ability to respond to your questions and how you respond to the recommendations, and then tailor it afterwards. This is just, there was a question yesterday about vagal stimulation. Interestingly enough, we see if you are able to improve the vagal tone, you're able to restore tolerance, at least into the mast cell compartment. So that you can do that with acupuncture, acupressure, you can do that with tailored breathing. We actually use oxygen concentrators, so it's not unusual for me to prescribe an oxygen concentrator to people that have chronic fatigue. That's a low-hanging fruit, a low-risk factor to try to help as well. I've also had the pleasure of working with Xiumin Li, who was a professor at the Jaffe Food Allergy Institute at Mount Sinai and now has her own independent lab, but she's had a lot of published data on the role of traditional Chinese herbal medicine. And I also have a colleague of mine who's introduced me to the role of Ayurvedic medicine, including Dr. Ruhoy. And again, you need to work with a practitioner who gets to know you and you get to know them so that you meet in the middle regarding the philosophy and effectiveness of what's been recommended. This is just going to show you the role of acupuncture. This was a retrospective review that showed efficacy. But again, it depends on who's doing it to you. It's not just like, and I work with, by the way, I do work with chiropractors, but they're considered functional neurologists. They don't crack your neck. They do a lot of other things to just assess how well your autonomic nervous system is working, and then they give you exercises that are tailored to improve that. I just wanted to show you, just because you have one thing that's causing your mast cells to misbehave, doesn't mean that's the only thing that's causing your mast cells to misbehave. This is a poor gentleman who actually had insect venom allergy. He also had meat allergy. He had airborne allergy to ragweed. And he also had two mutations in the mast cell, the hereditary alpha-tryptophanemia and the systemic mastocytosis. He actually is doing quite well once all of the therapies were tailored to the different ways his mast cells were misbehaving. So again, our lifestyle has completely changed within the past 20 to 30 years. And for the parents, think about how you grew up in and think about what your kids are growing up in. I think we've had an opportunity now to ask a different set of questions that can bring in different therapeutics. Again, 2 or more organ systems involved. I'm not asking what's causing the issues. I'm just trying to figure out if this is an issue with you. Matter of fact, I'm always delighted when somebody says they're just coming in with a runny nose. I'm like, are you really? Really? Is that all you have? You sure? It's unlikely that to be the case. And then it's really important sometimes if your data doesn't match the story, you got to think about other conditions. It doesn't mean you don't have anything. I'm just not barking up the right tree on the diagnosis. There are other conditions that can mimic mast cell activation disease, including POTS. Okay, and then there are other disorders that also can mimic mast cells depending on what organ systems you're talking about. So really important to understand that we're not just talking about controlling the mast cells. When it comes to therapies, we want to figure out what's irritating the mast cells. Is it coming from the epithelium itself, the connective tissue itself? Is it coming from other components of the immune system? Is it a metabolic disorder? Like we have a gentleman now, 4 years he's been suffering. He had a low alkaline phosphatase. There's a new condition that's been identified called hypophosphatasia. He lacks alkaline phosphatase. It looks like Ehlers-Danlos syndrome. So I think it's really important to understand we're getting more and more information now, matching lab abnormalities with genetic abnormalities that are now leading to new therapies. And this is just saying, So I want to end on this phrase. Polly Massinger is my heroine. She started off as a cocktail waitress at a restaurant outside of Scripps in California. And she was listening to the scientists talk, and she asked a question. So, it's all right to ask a question. They're like, that was a really good question. You should go to graduate school. She now heads one of the major labs at National Institutes of Health. And she was the one who talked about, let's not talk about self versus non-self when it comes to the immune system. Let's talk about danger. And does your body perceive danger? Because if it does, it's going to be the mast cells and the nerves that are going to step up appropriately or not. And so she said, basically, if you want to feel better, the power to restore tolerance into the tissue is reducing the stress, reducing the danger. And that whether it's physiologic or mental stress, that will wear on you. That's why sleep is important. That's why exercise is important. That's why diet is important, and meditation. And if you do that, you're going to be able to restore the balance. I'm not talking about cure. Restore the balance so that you have a better quality of life. These are just some resources. We just completed a National Academy of Sciences brought in an ad hoc group of practitioners. Now we have the Social Security now has our recommendations for taking care of Ehlers-Danlos syndrome and the diseases that run with it. And these are two books that I think would be really helpful for understanding the relationship between EDS, mast cell dysfunction, and connective tissue disorders. One is, and full disclosure, I wrote the chapter on mast cell dysfunction in both of these books. None of us receive any funds from this. It all goes to charities and research, all of that. But there's Transforming Ehlers-Danlos Syndrome, which I think has some wonderful life hacks to help you feel better. And then Disjointed, which came out about 2 years ago also. And the authors in Disjointed are all in the U.S. for the most part. And then regarding just information about mast cell dysfunction, you have the Mast Cell Activation Disease Society that just got renamed 2 years ago called TMS for a Cure. Again, I want to thank you for the invitation to speak with you this morning. I'm happy to address any questions. And we all stand on the shoulders of giants. I'm grateful for the opportunity to kind of share some of the things I've learned along the way.